Welcome to the Sleep is a Skill podcast. My name is Molly McLaughlin, and I own a company that optimizes sleep through technology, accountability, and behavioral change. Each week, I'll be interviewing world-class experts ranging from doctors, innovators, and thought leaders to give actionable tips and strategies that you can implement to become a more skillful sleeper. Let's jump into your dose of practical sleep training. Welcome to the Sleep is a Skill podcast. My guest today is Michael Murphy, MD. He's trained as a physician of sleep medicine and as an ear, nose, and throat ENT surgeon. He is one of only 275 physicians in the United States who is double board certified in these two fields. This dual certification enables him to treat sleep apnea, snoring, and other sleep-related conditions, providing a full range of treatment options. He is able to perform the Inspire surgery for patients with sleep apnea who have not tolerated other treatments. Dr. Murphy's practice is part of the Stanford healthcare system located in a community in the San Francisco Bay Area where he has practiced since 2002. His medical practice encompasses a full range of care for patients of all ages, from young children to adults and seniors. He is a dedicated physician, and his success is reflected in service to more than 6,000 patients over the past 3 years alone. His commitment to quality patient care is reflected in 220 grateful testimonies and almost 900 upvotes on the Stanford Healthcare website. Now, Dr. Murphy obtained his medical degree with distinction in research from St. Louis University Medical School, was top of his class, and was elected to the Alpha Omega Alpha Medical Honor Society. He did his residency at the University of Washington in Seattle, spent 2 additional years as a NIH research fellow, earned a competitive research grant, and completed a master's degree in public health. I think you're going to really enjoy this conversation that we had today on all things sleep apnea and more. If you, of course, have any questions, please don't hesitate to ask, and head right on over to the Sleep is a Skill website. And in the lower right-hand corner, we have a little sleep bot, so you can ask any questions that you might have around sleep, around what came up on today's podcast or other podcasts or anything sleep related. Please don't hesitate. We really encourage dialogue here. And if you're not on our newsletter, please be sure to sign up. That's at www.sleepisaskill.com/newsletter. We just surpassed over 200 newsletters, and we're looking forward to hundreds more. So please get yourself signed up there. And without further ado, let's jump into the podcast. All right, you all, I'm so excited to announce our new sponsor, Soul CBD. When I was at my lowest point dealing with my insomnia, CBD was one of the key compounds that I leaned into to combat my crippling anxiety, calm my nervous system, and support my journey to entrain my circadian rhythm. But of all the brands out there, where can you go that you can have a strong trust in their quality? Well, Soul CBD is completely THC-free, organically farmed, gluten-free, and third-party tested for toxins. Now, one of the things that is great about Soul is that they aim to help create rituals around your CBD use. And sleep and rituals are best friends. For instance, I love that Soul CBD supports a nighttime bath routine with their CBD bath bombs, which help to combat stress, soothe aching muscles with a mix of CBD essential oils and dead sea salts. Another ritual that we aim to cultivate in the realm of sleep optimization is circadian rhythm intermittent fasting, which is really all about eating your meals between sunrise and sunset. And Soul CBD has very popular gummies that can serve as a nighttime dessert or treat to look forward to without caving to ice cream. Nice alternative. My go-tos personally are their oils, capsules, topicals, and even CBD bath bombs. It's helpful for anyone who struggles with anxiety, pain, or sleep. Now, particularly when I'm traveling, I like to lean into as many things as possible to help with inflammation, and CBD does just that. Now, here's a really cool part cart, you get 15% off automatically and free shipping when you go to mysoul.com/sleep is a skill. I'm going to say that again. You get 15% off automatically. All you have to do is go to this link, which will be in the show notes, mysoulcbd.com/sleep is a skill. All right, let's get on to the show. And welcome to the Sleep is a Skill podcast. I am really eager to get into this conversation. Before even hitting record, my guest and I were going back and forth with lots of different topics that we are excited to share with you all. And I know we're going to make a profound difference in your journey to improve your sleep. So without further ado, thank you so much for taking the time to be here.
Thanks so much for having me. It's really an honor to be on your show. I listen to your podcast and it's always informative and always lots of helpful, real practical stuff.
Oh, good. Well, I'm so glad to hear that. It is certainly our intention to make sure that anyone listening walks away with things that they can begin to implement or research or take, steps to the next level. So, and I know we're going to get into that today. And this is so needed because we've only really had one real dedicated episode on the topic of sleep apnea. And I know you are beyond well-versed in this after decades and decades. So I'm going to put the spotlight onto you to share a bit about how it was that you got into this field and how this relates to how this can help support others looking to improve their sleep.
Yeah, sure. Thanks a lot. I appreciate that. So I grew up in the East Bay in the San Francisco Bay Area and went back to the Midwest for med school. And was anxious to get back to the West Coast. So I did my otolaryngology head and neck surgery residency. Most people refer to that as ear, nose, and throat doctors. Yes. It's a surgical residency. And I did that at the University of Washington. I was very fortunate because I finished up in 2002 and I was able to come back and kind of join my hometown ear, nose, and throat practice as a general ear, nose, and throat doctor. So I've been doing procedures for snoring and sleep apnea my whole career, although I do other stuff too. I'm a general ear, nose, and throat doctor. So I joke around and I say, when you're building an ear, nose, and throat practice, what happens is the kids come in and they need ear tubes. Then the mom has allergies and the dad snores and the grandparents can't hear and need hearing aids. So, that's kind of how you build your practice over time. It just gets busy. And I've been doing that my whole career. But, I really began to be more and more aware of just the importance of quality sleep in my patients' lives. And so, over time, I got more and more interested and ultimately decided to study for and pass the sleep medicine boards in 2009. And so I'm one of 275 physicians in the United States that are board certified as both ear, nose, and throat surgeons and sleep medicine doctors. And, I tell my patients a lot of the non-sleep apnea type category type issues like insomnia and shift work disorder. I have a lot of book knowledge and I'm learning as I go, but really the area where I see patients, day in and day out relates more to snoring and sleep apnea. So what that's allowed me to do over time is, it doesn't make me better. It just makes me different. I think it's allowed me to have kind of a big picture approach to patients who have snoring and sleep apnea. And that's really my motivation to reach out to you. And I really appreciate you having me on today because I want to, get the word out about this and kind of share how I like to approach these issues and, hopefully help a lot of people in the process.
Oh, absolutely. Well, if anyone missed that when they were listening, this is most likely one of the most well-versed people on this topic that many of us will have the privilege to hear from and going deeper on sleep apnea. So we're so grateful for you to be here and to share your knowledge, because I think certainly in what I've experienced from, many of the people that I've worked with around improving their sleep, the topic of sleep apnea has been so confusing for so many, and how to approach it, or a sense that it's a big, arduous task to navigate through, or what's even going to happen. Even if I have that, I don't want the mask, or I don't want to deal with this. So then just seemingly a lot of noise or story. So could you help us kind of break down what this looks like and make it a little less scary?
Absolutely. I'd love to. If you don't mind, I think what we'll do is we'll go kind of from 30,000 feet and we'll just work our way down, and then we'll finish up talking about some real specific stuff. One thing that I wanted to mention as well as terms of my background is that in addition to getting board certified in sleep medicine I think it was about 2018, there's a company named Inspire, and they have a surgical option for patients who can't tolerate CPAP or other treatments for sleep apnea. And they approached me to be one of the surgeons in the Bay Area that would be trained to offer the surgery to patients. So I tell my patients, of course, that they approached me right before COVID hit, so we got slowed down a little bit there, but we're getting up to speed, and so we'll talk about that a little bit towards the end too when we get into more specifics. So I guess the big thing I would start by saying is that all sleep, and all this well, but all sleep problems are just put into categories. There's about 6 major categories. So one category would be insomnia. Another category would be the circadian sleep rhythm disorder. So that would be things like shift work and jet lag, things like that. So snoring and sleep apnea come under the category of sleep-related breathing disorders. And they're by far the most dominant 2 conditions in that category. And it just so happens that they're incredibly common. So for all you're listening, I tell people I snore too. So I'm not just the president, I'm a client. So,
Yes,
these
nice. Appreciate that vulnerability.
yeah,
Demystify
absolutely.
that.
So these conditions are incredibly common. And so, we start with snoring, and it's really hard to know a little bit about how common snoring is because people define it really in different ways. But the general consensus is that if you define snoring as the noisy breathing and stuff at night, so it turns out that about 40% of US males are habitual snorers, meaning they snore nightly or almost every night. And about 20% adult women snore on a habitual basis. So it's shocking, but that rounds up being about 50 million men and about 20 million women. So there's about 70 million people in the United States that are adults that snore on almost a nightly basis, which is pretty incredible. Then, we talk about sleep apnea, and the numbers change a little bit, but they're fairly similar. So depending on how you define it, about 34% of US adult males have sleep apnea, and about 17% of women. So, and the numbers start to boggle your mind, but it turns out to be about 25 million men and about 15 million women have sleep apnea, not just snoring, but sleep apnea. So, these things are very, very common. And it's something that, I think most of us either have a spouse or a family member. And we can talk about the pediatric population as well, but even kids that snore, and we worry about that in the children as well. So there's probably not too many families that don't have someone who's snoring or have these concerns. So it's incredibly common.
Absolutely. And this can even extend to people that are not necessarily overtly or to an extreme degree snoring, so you can correct me if I'm wrong on this. My fiance was just recently diagnosed with REM dependent sleep apnea after so many times that I've been trying to urge him to get tested. And finally, Sleep Image had sent us a ring for him to test because he had been I'm fine. And we tested and saw that he had REM dependent sleep apnea and wasn't necessarily not someone that I would, complain of being a snorer per se. I wonder if you can also speak to this topic where it might kind of go under the radar a bit more and it might not have those kind of clear indications of, oh, that person's likely has sleep apnea.
Yeah, that's actually that's a great lead in what I wanted to talk to you next. One thing just to circle back on, and that is, and it turns out how common snoring and sleep apnea are.
Yes.
The thing that we know really clearly too is that there's a real clear relationship between weight gain and obesity and snoring and sleep apnea. And we'll talk about some of the anatomy and why that happens later. But in 2020, 43% of US adults were obese. And the crazy thing is that was up from 33% in just 2015.
Wow.
So only just in the last 5 or 6 years, the percentage of Americans that are obese have gone up 10%. And that's a whole nother discussion. But the point is, not only are sleep apnea and snoring incredibly common, but they're getting more and more common all the time. So, but to get back to what you were asking about, Molly, so the way that I like to explain it to my patients, and this is one of the key concepts I share with every patient that comes to see me, is I like to explain to them that your airway at night when you're sleeping is just a spectrum in terms of airflow. So on one end of the spectrum is streamlined airflow and the symptoms, nice, quiet breathing. You're happy. Everyone around you happy. Then at some point that streamlined airflow becomes turbulent. The symptoms become snoring. And then further down the spectrum, at some point that turbulent airflow becomes obstructed and you slip over into sleep apnea. And even those conditions are just a spectrum, right? We think of snoring in terms of how loud it is. So you can have minor snoring that's very light, or you can have super loud snoring where your partner's leaving the room, they're headed off to another room, or you're getting nudged and kicked all night long.
Yeah, sure.
Yeah, exactly. And then, sleep apnea itself ranges from mild to severe. So really every night when we're all breathing in terms of our airway, it's just one long giant spectrum. As you related to your fiance, It's not black and white. And if you have sleep apnea, you don't have it all night, every night. It can be related to different stages of sleep and other things like that as well. So, but I used to tell my patients all the time, in terms of where you are on the spectrum, it's important to tell the difference, because if you're snoring, that's a quality of life issue. And if you have sleep apnea, it's a health issue. And it turns out, I was kind of wrong about that, in the sense that, if you have loud snoring, you're probably very close to having sleep apnea, or you may even have mild sleep apnea. So it turns out that snoring is not great for our health either. And we can talk about some of the mechanisms about why that is.
Sure.
But one of the things that we're able to do now is we have these large databases where we can get access to lots of health information on people in large healthcare systems. And so increasingly, the researchers are able to look up codes for diagnoses and look into these databases. And studies are showing that people that are loud or habitual snorers have about a 30% increased risk of getting hypertension in and of itself. So it turns out that snoring is just not a quality of life issue. It can be a health issue as well. And then, as it relates to just some of the effects, the negative effects on our body, when we have these episodes, there's a couple main pathways that it happens. But as it relates again to your fiance, one of the things that happens in REM sleep is that's where our body tends to relax, in REM sleep. And that can lead to obstructions that maybe occur in that stage and not other stages as well.
Wow, really interesting. And how about UARS? Wondering if you can kind of break that down a bit for us.
Yeah, absolutely. So what happens is there's two main events that happen when we talk about the negative effects that are going on in our body when we're having these episodes of snoring and sleep apnea. And that leads to the cascade of problems. So really, you can think of it almost like, a fork in the road. So when someone's having either snoring or sleep apnea, the first path we think about is something called a respiratory arousal. And what that is your airway, the airflow through your airway isn't actually blocking off, but it's so turbulent, it actually causes you to ascend to a lighter stage of sleep. So when you go in the lab and you do a sleep study and they're measuring your airflow and all these other various parameters, you basically have electrodes on your head and they're measuring your stages of sleep. And they'll score something called a respiratory arousal, where the airflow is so turbulent, you literally go to a lighter stage of sleep. And so what will happen in this situation is, you'll score those events. And the other events we score during a sleep study have to do with actual blockage of airflow. So two major events, just to hit them real quickly, because it'll tie everything together, would be
Yes.
an apnea. And an apnea is where you make an effort to breathe, and somewhere in your airway, we'll talk about it a little bit later, there's a 90% or more blockage of airflow for at least 10 seconds. So you can think of it as almost a complete or total blockage of airflow in your airway for at least 10 seconds. And we term that an apnea event. And then a hypopnea event is a 30% or more blockage of airflow for at least 10 seconds with a little drop in your oxygen level. So I tell my patients all the time, it's a respiratory event. It's not as bad as an apnea, but it's still an event. So what's happening during your sleep study is, and we do this in the lab, we also do this at home studies like your fiance did as well.
Sure.
So we're totaling up these events, okay? And so when you measure up the apneas and hypopneas and you total those up, you come up with the apnea-hypopnea index. And that's the basic measure we use to determine if someone has sleep apnea, and if they do, how bad it is. As it relates to upper airway resistance syndrome, there's something called the respiratory disturbance index. And what that is they add in those respiratory arousals with the apnea and the hypopnea events. And so what that happens is when you get that diagnosis of upper airway resistance, it's a great question, Molly, because I usually tell people that actually kind of fits right in the middle of the scale, the spectrum between snoring and sleep apnea. It's kind of right between the two.
Sure, yeah.
Because it's more than just snoring. People are having arousals, but they don't technically fit into the criteria of sleep apnea.
Yes.
But they're still having all this interrupted sleep because of all those respiratory arousals that are going on in their body, and they're not spending enough time in the restful stages of sleep at night.
Got it.
Yeah, that's defined when someone has what's called a respiratory disturbance index that's, over 5 or elevated, but they don't meet the criteria for sleep apnea. And they kind of fall in that gray zone between snoring and sleep apnea.
All right. So I would love to kind of dive into a two-part expose on these topics. So one being testing for this. So people might be listening and speculating, all right, maybe I need to go deeper on this and actually get this tested. If you can, one, walk us through that process. And then on the second side of that, some of the solutions, depending on where they fall in that spectrum. But for the first part, we're questioning, all right, maybe I have this, maybe that's part of unlocking this key of why I just feel so tired or having those, particular symptoms that seem to relate to the possibility of sleep apnea. What are my options, both in the lab and then at home?
Yeah, great question. So I like to kind of think of it as a steered, kind of a stepped up approach in terms of how we think about it. So, the first thing, that helps you get a sense of where you are on that spectrum is, how you feel, but also, what your partner says about you. So
Yes.
for instance, one of the things I've asked, usually a guy will come in and he's snoring and his fiance or his wife or his partner's there with him, and he'll be talking about his snoring. And one of the first things I'll ask the person that's with him is, are you worried about their breathing? I know they're snoring, but are you
Sure.
worried about their breathing? Because studies have shown that if your bed partner or whoever's around you not only says you're snoring really loud, but they're witnessing these apneic events, or they're worried about your breathing. Or some people say, yeah, I actually have to shake my partner every once in a while because I don't hear him breathing. Studies show that's if you correlate that, it doesn't mean you have sleep apnea, but it's pretty predictive.
Yeah.
And then, of course, if you've got the daytime symptoms where you're waking up with headaches, having trouble with memory, concentration, a lot of daytime sleepies, we'll talk about a practical tool for that in a minute.
Great.
So the first thing is just your nightly quality of your sleep and your story and whether people are worried about you. That's a start. Then there's a couple of practical questionnaires that people can use that I use in my practice that are great. So the first one that everybody is listening can write down, and we can include it for them, is something called the Stop Bang Questionnaire. And it's STOP-BANG. It's a questionnaire. You can Google it. And that's based on 8 basic questions that are asked of patients. And what happens is with each question, you actually just score them. If the answer is yes, it's a 1. If the answer is no, it's a 0. And you work your way through this questionnaire. And by totaling up the total of that questionnaire, it gives you a pretty good idea of the risk about whether or not you may or may not have sleep apnea. So I don't know, Molly, if you want me to walk you through that or if we just leave that for there and go from
Sure.
there.
Well, that could be great to kind of hear since you said it. I just pulled it up and there's just a couple of questions. So that's fantastic. And I'll make sure to include that in the show notes. But yeah, any big call outs there so that people listening might say, ooh, that sounds like me.
Yeah. So, that, and the first question on the Stop Bang is whether your partner sees you stop breathing or not at night.
Yes.
So it fits right in. And it asks you a little bit about whether you have some elevated blood pressure. And so that's one practical thing you can do. There's also something called the Epworth, EPWORTH sleepiness scale.
Yep.
And that was a sleepiness scale that was used all throughout the country and around the world as a quantitative measure, in general, how sleepy you are. And you can look that up. But basically what it does is it has some different events during the day, situations you may be in, and it asks you to grade what the likelihood is that you would fall asleep or doze in those various situations. And again, it's a quantitative thing you can score, and it gives you a general idea of your sleepiness. And it's helpful to know right off the bat what your baseline sleepiness is. And it's also can be helpful, as we treat people to see if they're responding in terms of the daytime symptoms. So those are 2 practical kind of questionnaires and tools that people can use to kind of get an idea of where they may fall along the spectrum.
Fantastic. Yeah. I mean, I think it's so helpful because we might just chalk this up to a swirl of, oh, I know I got to put the phone away. I got to go to bed earlier. I got to do this and that, and chalk up our kind of maladaptive behaviors to, and the results with those to, that's why we're not totally rejuvenated. And yet you're pointing to something very distinct and different. And so, but even just through a couple questions, so we'll include both of those in the show notes so that people can check those out and see, does it look like you are a candidate to get tested for this?
Yeah, exactly. So then, we talk about, what your partners are telling about you. There's some questionnaires you can use to help out a little bit. And then, there's all kinds of tons of consumer, options out there that people can use to kind of check the quality of their sleep.
Sure.
So you could have the Fitbit or your Apple Watch, or there's a company called Withings that has a watch. And all these, I call them consumer devices. I break them into 2 categories. One is what I call wearables, and those things you actually wear on your body, whether it's a watch or whatever it might be. And then they have something called nearables, and you've probably heard about those. That's where you get the sleep, the sleep comfort bed, and it's got the mattress thing in there that tells you about it's gathering information. And
Yes.
those things really can really help us in terms of getting us a basic idea about the quality of our sleep. But most of them aren't really FDA approved. And keep your eye out because these companies, there's lots of them out there, and companies are doing a great job with evolving technology and they're becoming more and more sophisticated. But most of those consumer devices aren't really going to help you determine whether or not you actually have sleep apnea or not. And
Sure.
so, what I would say to everybody out there is that, if it really looks like, and this is, I guess, where the rubber meets the road, if you're snoring really loudly or you do the questionnaires and you feel like you may have sleep apnea, it's really important that you seek out a provider so that you can be, seen and evaluated. And you alluded to it with your fiance, because really, at the end of the day, when we're trying to determine where you are on the spectrum, you may need some more formal testing. So, for
Yes.
instance, you referred to the sleep image device.
Yes.
That's a really cool device, but you know this well. But basically, what you do, you have to be a licensed provider to provide this for your patients.
Yes.
But what you do is your provider will set you up with this sleep image device, and you basically wear a ring on your finger, and that ring gathers three pieces of information while you're sleeping at night. So number one, it does essentially an ECG where it measures how your heart's behaving electrically. It measures the oxygen levels in your blood. And then it also measures the activity of your blood vessels. And so you download an app, and this ring sends information to the app, which then goes to your provider. And this is able to do some amazing things in terms of the information it gives you for your sleep. So it tells you about your sleep quality and efficiency, what percentage of the night you're in bed you're actually asleep. It will tell you how long it takes you to go to sleep when you get into bed and how long you're actually asleep. It can measure sleep apnea events because it's measuring the blood vessel activity in your finger.
Mm.
So, and this information is all transmitted to the provider, and then they can, of course, make a diagnosis. And as with your fiance, the information also keeps track of sleep stages. So they can actually determine, as they did with your fiance, if the sleep apnea is present throughout all the stages at night or if it's just in certain stages. So,
Absolutely. Can you because there certainly are becoming a lot of different options for people if say they do choose to do the at home or in the lab kind of approach to get tested, are there certain things that you would have people think about if they are choosing some of those providers or certain tests? So say for the at home, are there ones that you feel like have more validity or anything to kind of guide through on that topic? And are there times when it makes sense to be in a lab specifically?
that's a great question. So, it's actually ironic because in my practice, we've been doing home sleep studies in my practice for, I would say, probably the last 7 or 8 years.
Okay,
And
great.
I've done a number of systems. There's a company called ResMed, RESMED, and they had
Sure.
a system. Philips Respironics has a system called the Alice system. That's a home sleep study system
Yes.
that's widely used. In the last few years, I've moved on to something called WatchPat, WATCHPAT, and I'm having great luck with that. And ironically, Molly, it's almost the exact same setup that the sleep image system uses. So, I tell my patients, it's based on this adrenaline idea. So one of the things that happens, pathologically in our body is when you either have one of these respiratory arousals, what happens is our a sympathetic nervous system gets activated. So we have this automatic nervous system in our body, right? There's two sides to it. There's the sympathetic system, which I call that the fight or flight side of the equation. I call it the gas pedal. Okay. And then we have
Yes.
our parasympathetic nervous system, which slows us down. I call that the brakes. So the idea is that when we're sleeping, we want to get into these deep restful stages of sleep because when that happens, the parasympathetic nervous system takes over. So it allows our body to slow down and recover. Our heart rate goes down, our blood pressure goes down, the brain glucose metabolism speeds up to clear our brain of all the effects of the day's activity. And our body growth hormone comes out, so our body heals itself. So the problem with these respiratory arousals is when that happens, we never get into that restful stage of sleep. We don't spend enough time in those restful stages of sleep. And instead, our body gets stressed and we go into the fight or flight response. And then what I tell my patients is it's all gas pedal and no brakes. Your body never gets a chance to slow down. So with respect to these systems that are diagnosing it, whether it's the sleep image system or the watch patch system, when that system gets activated, because we have sleep fragmentation, Or the other side of the equation is if you have an apnea or hypopnea event, your oxygen levels are actually going to drop down. We call that hypoxia. And that does the exact same thing. That kicks in the fight or flight response. So you can get to that fight response two different ways. You can do it through fragmented sleep and respiratory arousals, and or you can do it when the oxygen levels go down, when the airway blocks off. But once that happens, when that body goes into fight or flight mode, our heart rate and our blood pressure goes up. But one of the things our body does is it constricts the blood vessels in our hands and our feet because it's shunning blood to the core of our body. It's the basic fight or flight response. And that's how the sleep image and the watch pad system works. So for instance, with the watch pad, it's very similar. Patients wear a thing on their wrist and it measures their sleep stages and their body position in bed. And there's a thing on their finger, just like the ring for the sleep image system, and it measures constriction of the blood vessels. So it can identify these events. So that's the basic way that these things are keeping track of these events and correlating these events and helping us figure out what's going on. So, these home sleep study systems there's lots of different ones and they work different ways, but in essence, that's what they're doing. Now, traditionally, for many, many years, people would go sleep in a lab, but for practical reasons, for insurance reasons, and for a lot of other reasons, going to sleep in a lab is becoming less and less common.
Wow. Okay. Well, I mean, just for the ease of use, I think there's certainly some wins there. And thanks for breaking down how they're able to detect some of those apnea events. And then, real quick, wondering if you can share. I know you mentioned the insurance piece, and I'm sure that's a big topic, but just to demystify this a bit for people, if they might think that, this is going to be thousands of dollars, this is going to be a big hassle. Can you share how this could go and hopefully the ease with which people could get this tested?
Yeah. One of the things, let's step back just for a minute. There's a couple different ways that people can connect with providers, because we had talked about the
Yes.
importance if they feel like they may have sleep apnea to, see a provider. And so
Yes.
one of the things you can do just for starters is start with your primary care doctor. Primary care doctors increasingly, this is happening in our Stanford system and in systems throughout the country. Primary care doctors are increasingly being able to provide access to these home sleep study systems or refer you to someone who can. Other options would be, if you go to the American Academy of Otolaryngology website, that's the national ENT website, there's a link for Find a Provider. And you can just put in your zip code and it'll tell you the ENT doctors that are in the area. And it's the same thing for the American Academy of Sleep Medicine. That can get you access to either, board certified sleep doctors or ENT doctors. In addition, if you don't just start with your primary care provider. But, ultimately the way it's working, Molly, is that increasingly insurance companies, as sleep apnea and snoring become more prevalent and as we become more aware of the serious health effects if we're not treating these, I'm not running into any problems with these, home sleep studies, especially, being covered for my patients by their insurance company. And then, in fact, the insurance companies are encouraging these as opposed to in-lab studies.
Wow, that is very good to hear. So, a couple different steps for people to take that are very accessible from the sounds of it, becoming more something that they can take steps where, with ease, they'll be able to have some answers for these often years and years of questions of, do I have that? Could that be? And now we can actually have some answers. So that's fantastic.
Yeah.
Now, from that place, real quick, I know you mentioned the wearables and how certainly those cannot be diagnostic. I do hear a lot of people speculating around two pieces of kind of biometric feedback and wondering, could this be a sign for sleep apnea? The two pieces being their respiratory rate scores and their blood oxygen scores throughout the course of the night. Now, naturally, those cannot be diagnostic, but have you seen this be enough of a flag on wearables that it's had people take steps? Is there any validity to that?
Yeah, I do think there's validity to that. I think that probably the most important one of the two you mentioned have to do with our blood oxygen levels.
Sure.
So
Okay.
the apnea hypopnea index for years has been the basic measure that we use to grade sleep apnea and how bad it is and determine if people have that. And there's a lot of debate going on nationally and internationally about that being the measure. And people have some criticism or not. The bottom line is right now, it's the best measure we have.
Sure.
But as these devices and we have these wearables and all these other things are able to track our oxygen levels, it turns out that one of the more significant predictors of if someone has sleep apnea, if they're going to go on and develop diabetes and some of these other problems, is actually their oxygen levels throughout the night and the extent to which they drop.
Okay.
So I guess a practical answer to your question is, the fact that these wearables and some of these things are able to follow our oxygen levels at night, I think that's incredibly helpful information. And
Great.
really, if it raises a flag at all, that's just one more piece in the puzzle, right? In terms of
Yes.
determining if you have to seek out answers. And then, of course, we go through the process of testing, and then that moves us on to the whole issue of treatment.
Yes. And to that point, so now people have tested, they get back the information of where they're falling on that spectrum that we spoke to. What are the possible solutions for people, and what are some that might be kind of newer that they most likely have not even heard of?
Yeah, great. So I want to start with a couple big. So treatment for sleep apnea as a whole. You can really get into a lot of specifics. I'm going to start with a couple big picture points,
Okay.
and then we can touch on a couple things that I think will be interesting for people. The bottom line is, in terms of treatment, is that if you think you have sleep apnea, and I'm glad we had a chance to cover this, you need to get to a provider and get yourself tested and see. I think have a physical exam by someone is really important. I'll give you a couple of practical examples of why that's important in a few minutes. But what I would say more than anything is that the most important thing you want to try to do is you want to try to determine what the cause of your snoring or sleep apnea is.
Mm.
Because once you know what the cause is, we can really start to talk about solutions. And what I really want people to try to avoid doing is what I see in my office sometimes, and I feel bad, it's frustrating for them, is if you don't know what the cause is, you can spend lots and lots of time looking into solutions that may not even be relevant for you. And so
Yes.
that's where, we go down the rabbit hole on the internet and spend hours and hours and hours researching things that, may or may not even be, relevant to our particular situation. That would be the first big picture thing. And then the second thing I would say is, treatment in a lot of situations is going to wind up being a collaborative effort. So it's very rare for me to have someone who has sleep apnea and I'm the only person that helps them and I'm the only person that treats them. There's different levels involved in terms of where we could be having problems with snoring or our sleep apnea. So for instance, it could be a problem with our nose, and
Yes.
our nose itself, I tell my patients it's kind of like a math problem with two variables. You got the structure of your nose and you got the lining of your nose. Those are the two issues. So obviously, if there's a deviated septum on exam, or you have some polyps in your nose or something obstructing your nose, that's where, I come in as a ear, nose, and throat surgeon. But a lot of
Yes.
people have trouble with the lining of their nose. We call that rhinitis, and they've got allergies or other things. So we got an allergist involved to, help treat them. So
Mm.
a lot of times treatment winds up being a collaborative process as well.
Really important. Okay. So it seems that there are some facilities that are online that they'll send, an at-home sleep test, and then you have like a virtual consultation with the doctor to go over your results. For you, in your experience, would you highly suggest then that people take the steps to then make alternative appointments to then ensure that they are getting this addressed in a holistic manner
Yeah.
versus just a one
Yeah.
and done?
Yeah, it's interesting with the advent of telemedicine. It's a great thing because it's allowing a lot of people that normally wouldn't have access to a provider, or maybe you live in the rural part of the country and it's a long drive for you to get to see a provider. And maybe there isn't a sleep specialist and an ENT right in your area. So, I think the idea of having telemedicine and allowing people to have a virtual visit with someone and get the history, get the ball rolling, get a test done, determine if you have sleep apnea, that's all incredibly positive stuff. I do think at some point it's really important that patients, see a provider and get examined. And the reason why is at some point someone needs to take a look in your nose and throat and see if there's any issues going on there. I'll give you an example. So I had a 75-year-old guy who came to see me last week, and he came to see me for the Inspire device because he was having trouble with CPAP. That's one of the criteria. And he was super frustrated because he tried like 10 different masks and he was feeling like a complete failure because things weren't working out. And it wasn't anyone's fault really, but he had been diagnosed with sleep apnea and been on CPAP for 4 or 5 years, probably in part because of the pandemic. It had been hard to see providers, but no one had ever really looked in his nose, and he had tried a bunch of nasal masks. And it turns out he had a severely deviated nasal septum. And that was the reason why he was struggling for so long. And that's a pretty quick fix. Take him to the operating room and straighten his septum, and hopefully that addresses it. So all these things are incredibly positive, and something's better than nothing, but getting exams at some point I think are important.
Great. Okay. So we want to evaluate where the problem is coming from, the root cause. And then from that place, what are some of the different types of things that people might treat this with?
Yeah, yeah. And so then the next concept would be in terms of treatment, the general trend is we like to start with the least invasive things and move to the more invasive things. I tell people all the time, even though I'm a surgeon, we don't go barreling ahead with surgery. We usually try
Yes.
non-surgical things first. And that goes for all my patients. So let's just give you one example. We can
Sure.
talk it through because it relates to the Excite device and the Inspire device.
Great.
So, some people will have a trouble with obstruction at the level of their tongue.
Yes.
And so, the main muscle that allows our tongue to stay forward at night is called the genioglossus muscle. It starts in the inside of our jaw and attaches to our tongue. So when it contracts, it pulls our tongue forward. So it so turns out that when we sleep at night, the tone in that muscle goes down, which makes our airway more collapsible. In addition to that, as we get older, unfortunately, like the other muscles in our body, it loses some of its strength.
Yes.
So it's more prone to be weak and collapse. And then studies have shown that for people with sleep apnea, that muscle tires out more quickly, which again makes them more prone to have obstruction. So when it comes to, treatment, let's just talk about the tongue for a minute. If people have just mild sleep apnea, the two standard treatments for sleep apnea that are non-surgical are oral appliances and CPAP. And you alluded to the show you had with the oral appliance provider.
Yes.
And those are great options. And to be very, very clear, if people have, mild to moderate sleep apnea or significant sleep apnea, those still are the two main standard, well-accepted treatments that are non-surgical if patients are having trouble at the level of their tongue.
Sure.
Now, that said, there are things called myofunctional exercises where you can actually work with a myofunctional therapist. There's ways to get connected with those people. And you do exercises to strengthen not just the genioglossus, but the other muscles in your throat.
Wow.
So that's one option. Now, in a relatively new option that's coming out is something called Excite. And you had mentioned to that.
Sure. Yeah.
And really what that is that Excite's a tongue stimulator where you're doing electrical stimulation to the tongue muscle to strengthen it. And there's some studies that have come out. There's a large multi-center trial that's coming out. But right now, the studies have been done just for people with mild to moderate snoring and mild sleep apnea. So it's not really with people with moderate or severe sleep apnea. But for those patients, the idea is that you have this stimulator device. And for 20 minutes a day for about 6 weeks, what you do is you put this device and it stimulates your tongue with the electrical stimulation to strengthen the muscles of the tongue. And the original results have been pretty good. People have had a reduction in their AHI. Snoring has been consistently improved, and it is becoming more available. So that's something that I think is, going to come down the road, and we'll get more and more data as that comes out. And it looks like for people with certainly with people with snoring, and also people who have mild sleep apnea, that might be a good option for them.
Interesting. Okay. That's touching on a kind of relatively new device. And how about the palate expanders? Is that anything you suggest?
Yeah, that's good. So the way that works is I tell patients, the way I kind of explain the palate expanders is that the roof of your mouth is the floor of your nose. If you just kind of conceptually think about that.
Sure.
So, if you kind of put your fingers out in front of you and you think of the roof of your mouth and your nose is a triangle, if you have a nice flat palate, the bottom of that triangle is nice and flat, a big airway. If you have a high arch palate, that narrows the bottom of the base of that triangle. So the idea is that if you have a high arch palate, the base of your nose is much smaller and it narrows your airway.
Right.
And so by doing palate expansion, you're basically making that triangle larger. And I think, a high arch palate and a narrow nasal airway is something that I think we need to be more aware of. And I think that people can have, if they have that issue, palate expansion is a really good option for those people.
Great.
So it's interesting you mentioned that because whenever we think of trouble breathing through our nose, I saw a patient last week, exact same situation. People always think of problems on the inside of their nose, like polyps or deviated septum. But the problem might not be in the inside of your nose. It might be your palate. And, that circles back to an exam. And we see that in kids too. And it's very important in the pediatric population. If the patients are snoring and they have those high arch palates, that it's nice to fix that sooner rather than later, because that, of course, relates to facial growth and all those issues as their face is developing over time. So it can be very helpful in adults, and especially important in the pediatric population.
Oh, so important. I love this concept of, even attacking this early so that we have the ability to make some of these corrections right out of the gate and then be able to hopefully correct over time and retest and see what's working and what's not working. So that would be fantastic.
Yeah, that's right. And I'm glad you had the person on to talk about oral appliances because in my practice, I really think, they're underutilized. So,
Sure.
the idea is that the American Academy of Sleep Medicine says that for people who have mild to moderate sleep apnea, an oral appliance is an acceptable first line of treatment instead of CPAP for patients. And
Okay.
so, especially if patients are having obstruction at the level of their tongue, and that usually relates just to their jaw position, and that's how they're kind of created. They may have a jaw that's maybe a little more posteriorly positioned, or if the mandible or lower jaw is a little more narrow, that your tongue sits a little higher up in your mouth. And so bringing the lower jaw forward, and the tongue's a unit, it works with the jaw. So if the jaw comes forward, the tongue comes forward. An oral appliance can be a great first line of treatment. The American Academy of Dental Sleep Medicine is a website, much like the other ones I referred to,
Sure.
where, if you're a member of that academy, it means you're a dentist that's done additional special training in dental sleep medicine. And those are specialists that, have expertise in that. So oral appliances are a great option as well.
Great. Okay. So then, if people are looking to take the oral appliance route, is that something then you would recommend for them to go directly to their dentist? Or would you say, no, you'd want to kind of still begin with the ENT, or are there kind of a triage that you suggest for people?
Yeah, I do think that practically speaking, I think that starting with the dentist is a good idea because they're
Okay.
experts in occlusion, and increasingly, it's great. I'm catching up with the dental community. That's probably what's happening. But I think the dental community is really aware of airway concerns and airway
Sure.
issues. And with a lot of the facial scans and stuff the dentists are able to do, they're actually able to measure the size of the airways. And so, if you have any concerns about that, I think talking to your dentist and seeing if your jaw seems to be normal in position or in width, that's a good place to start. One thing I will say, and I tell this to my patients with oral appliances, it's really important. When they make the appliance for you, the upper piece goes into position because your upper face doesn't move. And then the lower piece attaches to the upper piece, right? So as
Mm,
your lower jaw comes forward, your tongue's going to come forward with it because they're attached. But the key to that is when that appliance is in, you can't open your mouth.
mm.
So you can breathe through your mouth a little bit, but you can't open your mouth. So one of the key things I see in patients all the time in my practice is oral appliances are great, but you got to be able to breathe through your nose. So, that's
Yes.
one thing that's important to keep in mind is if you have trouble breathing through your nose at night, it doesn't mean you can't ultimately use an oral appliance. You probably can, but it gets back to what we talked about earlier. You need to figure out why you're having trouble breathing through your nose.
Absolutely. And how
Yeah.
about the popularity that's emerging around mouth tape? Is that something that you think is more layered of a topic, or could be concerning, or any dangers there? Or
Yeah, great question. It's so interesting you mentioned that because I just read a fantastic book called Breath by James
yes,
Nestor.
so good. Yes.
Uh, it's so good. It's so good. And he did that experiment where they closed off his nose for a couple of weeks, and within a couple of nights, he developed sleep apnea. And what I would say about that is, and it's a great lead into what we just talked about with the oral appliance. But we're designed to breathe through our nose. That's just how we were made.
Yeah.
And if we're not breathing well through our nose, there's a whole cascade of problems that go along with that. So the idea with mouth taping is, and James Nestor referred to this in his book, is that by taping your mouth, you're basically forcing yourself to breathe through your nose. And the idea
Mm,
is that by doing that, your nose is going to make some adjustments because our body's always adapting. So your nose accommodates, and over time is going to make some adjustments so that you're breathing more effectively through your nose. I'm all for that. What I would say is I don't think it's a treatment at this point. If you have
mhm.
mild to moderate sleep apnea, mouth taping isn't a treatment.
It's not that. Yes.
But I think that using that, to improve your nasal airway is interesting. And I think there's a lot of merit to that. And there's even some companies now that are, coming out with branded mouth tape and all those other things, which is good too. So,
Yes.
yeah.
Okay. And then, so we've touched on some of the things that people could do to treat this. Anything that we left out around the CPAP, Inspire, or even laser
Yeah.
treatments? Anything to share there?
Yeah, great. Yeah, we're right on the same track because I just wanted to talk about CPAP. So,
Yes, please.
one of the things we talked about is getting at the root cause of why you're having snoring sleep apnea and addressing the solution. So, one of the most important messages I want to share with everybody, and it has to do with CPAP. And that's as you know, the gold standard treatment. And the reason why it's the gold standard treatment is because number one, there's no medical complications from CPAP. It can be super annoying, which we can talk about, but there's no medical complications of CPAP. And the other thing is, I say to my patients, it's the quickest, easiest way to know if your sleep apnea is gone. Because you're going to get up in the morning and the machine's going to tell you if you had any events. There's going to be app, you're going to have an app on your phone. It's going to tell you how many hours you used it for, if you had any apnea or hypopnea events. It's going to give you all the information you need. So what I tell to my patients is all the time, if we're trying to get at the underlying cause of what the problem is, sleep apnea doesn't have to be a life sentence. It can be a temporary tool. And so, I think that one of the reasons why I see patients and they come to see me and they failed CPAP, and again, I'm not being critical, I'm just explaining the situation. Someone did a sleep study on them. They may not have had a physical exam, maybe they have, maybe they haven't. And they get prescribed CPAP and someone hands them a prescription and gives them a machine, and then that's it.
Right.
And the patient says to themselves, wow, am I going to have to sleep with this machine the rest of my life?
Right.
And so what I say to my patients is, especially as it relates to the weight piece, it turns out when we put on weight and gain weight, we gain weight in our neck, right?
Mm-hmm.
That causes collapse below our tongue. That relates to your collar size. And we see the people with the big necks and the sleep apnea. But it also turns out that when we gain weight, we actually gain weight and put fat in our tongue. So they've done very interesting studies where they do an MRI scan and they measure the size of someone's tongue. Then the patient loses weight and they repeat the MRI scan and the tongue's literally smaller.
Very interesting.
So in the American Academy of Sleep Medicine says, if you have sleep apnea and you lose 10% of your body weight, you actually need to be restudied. You may not even have sleep apnea anymore. Or if you do, it may not be nearly as severe.
Sure.
So my patients that have, a weight component and they have sleep apnea, I actually tell them, CPAP's your friend. It's not a life sentence. This is a tool you're going to use to reverse all these negative, effects going on in your body, pursue some weight loss, and we'll look forward to the day when we can have our throw away the CPAP machine party. I think how you approach CPAP in terms of your mindset has a lot to do with how well we tolerate it and whether or not people stay on it. Now, one interesting thing, Molly, is that one of the things that people have a real hard time with CPAP has to do with the headgear and all the masks. So there is actually a company called Beep Sleep. It's BEEP SLEEP. And what they've done is they've developed a CPAP system that's based on adhesives that doesn't require masks or headgear. The technology is evolving. And so that's just kind of a cool new thing that's out there that people can use. Because really and by the way, some people do need CPAP for life. I don't want to give the wrong impression there. And CPAP is incredibly effective. The studies are very clear on CPAP, and I would never want to give people the wrong impression.
Sure.
CPAP is the gold standard for a reason because it's very effective for the reasons we talked about.
Yes.
But, it's one thing to see it as a life sentence. It's another thing to be sleeping well and using it while you're continuing your journey to try to figure out the underlying reason, why you're having these conditions.
I like that reframe. I think that's really important as people navigate that. So it's, not something that becomes a non-compliance issue. And instead it's something along the way of actually making a difference with this profound area. Fantastic. And how about laser treatments or Inspire or anything else that we need to touch on as far as possible treatments?
So the treatment falls, the treatment depends on the level, right? So if there's a nasal issue, you can use some nasal treatments. There are some laser procedures for the palate. And so, if multiple levels are involved, the most important thing to understand is, you've got all to treat the levels. If you fix your palate and your tongue's blocking, you're still blocking. So what I would say is, again, that gets back to understanding the level where the problem is and coming up with the appropriate treatments. Laser, procedures on the palate can be very effective at that level. The Inspire device is interesting because we had talked about myofunctional exercises and the Excite device. We're walking up the ladder, right, for tongue obstruction. And, then we get into the oral appliance. And so, the Inspire surgery is a relatively new surgical procedure for patients that have obstructive sleep apnea. That really, it has to be moderate or severe. The
Sure.
apnea hypopnea index has to be between 15 and 65, so it can't be mild sleep apnea. It can't be terribly severe either, where people are having 80 blockage events a night.
Mm.
But for those people, those are people that are intolerant of CPAP. And by that, I mean they really have tried and they literally cannot tolerate CPAP. Some
Mm.
people are claustrophobic. Some people may have allergic reaction to multiple
Oh, wow.
masks.
Yeah.
And so this is a surgery where for the appropriate patient, I've had excellent results. And we don't operate on the tongue or the jaw. We operate on the nerve that moves the tongue. So we go to
Mm.
the operating room and we make an incision under the jaw there in the front. And I find the hypoglossal nerve that moves the tongue. There's branches that move the tongue back. You don't want those because that's going to obstruct your airway. We find the branches that move the tongue forward. And under the microscope, we do nerve stimulation and we identify those branches. And we put an electrode cuff around those nerves.
Mm.
And then we go down into the chest. It's on the right side instead of the left. You can almost think of it like a pacemaker, but it's on the other side.
Mm.
And on top of the pec muscle, the chest muscle, we put what's called the pulse generator. It's kind of the brains and battery of the device. Then finally, we go between the second and third ribs through that same incision in your chest, and we slip a little breathing sensor in between the breathing muscles. So what we do at that point, the last thing I do is I tunnel the little electrode from neck down into the chest, and we hook it all up. And the way it works is when you go to breathe at night, the breathing sensor in your chest sends a message to the pulse generator. And then that in turn sends a message up to the electrode and it moves your tongue forward. So every time you go to breathe at night when you're sleeping, your tongue's coming forward to open your airway. So that's the basic idea of how the Inspire device works. And it actually is controlled by, it's almost like a TV remote control. It's a little handheld device that sits on the side of your bed. So you turn on the device and hopefully you're asleep before the device starts working. And as you're sleeping, your tongue's coming forward to open your airway. So that's one of the relatively newer options for people that have sleep apnea that are not really tolerating at this point other options of treatment. And like anything else, the indications for that type of technology may evolve over time and it may be more widely available. But that's the general concept for it at this point.
Awesome. Okay. Anything we left out in the kind of walkthrough of those different treatment options, or did we hit on most of the ones available at the moment?
I think so. I think we've
Yeah.
covered oral appliances and CPAP on a kind of a big picture, thing and some of the newer treatments. So, yeah.
Fantastic. Okay. So then that brings us to the final part of the podcast where people have commented that when we have people on the podcast that have such an immense level of information around sleep, they want to know, well, what are they doing for their sleep? So, and I'm sure this is dynamic and I'm sure this shifts different points and if you're traveling and lots of things, but let us know. The first question is, what are you doing currently for your nightly sleep routine that we might learn from?
Yeah. Okay. Well, one of the things I'm trying to do is just make sure that I'm going to sleep pretty much at the same time every night so that my
Sure.
body's, settling into a routine and trying to pretty much get up every day at the same time as well. So my body's settling into routine. Sometimes I'm good at this, sometimes I'm not. We know that alcohol reduces the
Yes.
tone of the muscles in our tongue and throat. So ideally, I'll have my glass of wine a little earlier in the night.
Yes.
If I don't do that, then myself, but more importantly, my wife probably pays for that a little bit. So,
Yes.
the idea of enjoying a glass of wine, but a little earlier in the evening promotes good sleep. Alcohol does affect the quality of our sleep in multiple ways. One of the things it does is it causes us to go into our REM sleep at a different time of the night, and that ultimately will lead to early morning awakenings. So, if you're having a little more alcohol than you should, you may find that you're waking up early in the morning before you'd like to. So that's a basic sleep hygiene thing that we all, probably have days where we're better and worse at. So those are a couple things.
Great. Okay. That's fantastic. And then your morning sleep routine, might sound like a misnomer, but really we do that intentionally with the belief that how we set up our days can impact our nights. So any noteworthy things around your morning routine that are important for managing sleep?
That's good. I'm going to be real honest with you that I probably should look into a little bit better morning sleep routine. Usually I'm hopping out of bed and trying to grab a little exercise before, I get my day going. So you might be
Sure.
able to teach me about that one, Molly.
Okay. Well, so Fantastic. Playing into that cortisol pulse a bit. Any emphasis on sunlight or light therapies in any way, shape, or form in the mornings, or something that you're evolving with in your relationship to that?
I'd say I'm more evolving in my relationship to that.
Okay, got it. Well, certainly, I think many of us are doing that very same thing. So fantastic. We'll have to circle back with you in the future and see how that's all going. And then the next question would be, what might we see on your nightstand, or it could be your proverbial nightstand if you're traveling? So apps or gadgets, ambiance, etc.
Oh, traveling or at home or both?
You could do either one, whatever one speaks to you that you think might be noteworthy for people to hear about.
Well, in the relaxation mode, on my nightstand at home, my wife got us a diffuser. So as we're going to bed at night, we try to get a little bit of a relaxing spa-like vibe there going. I guess that might relate
Nice.
to my nightly sleep routine a little bit
Yeah,
there.
a little bit. Nice. I like
Yeah,
that. It's
yeah.
very cool.
I usually have a good book on my bedstand. Right now, I'm reading a book called Why We Sleep by Matthew Walker. He's a
Yes.
PhD scientist out of Berkeley, and he does an amazing job of being this incredible, hardcore science researcher. But in his book, he explains the science of sleep in a really kind of rubber meets the way, a road down to earth way. So I'm reading that. And then right now we just got a family picture. We went to Mexico and helped build a home for a single mom with a 3-year-old son a
Oh,
couple months
nice.
ago. And so that was just a really cool family time. So we got a picture of that on the
Oh, I
nightstand right
like
now too.
that. You're one of the first people to mention something like that can actually just, inspire a response of a memory and a feel good response. So I love that. Very cool. And then the last question would be, what would you say might have been the biggest aha moment around the management of your sleep, or even that's made the biggest change to your sleep game?
I think the biggest thing for me is just trying to make sure that when I, head back to go back to sleep, I just kind of get myself, I joke about the diffuser, but I think it's really important that I just try to get myself kind of into relaxed mode because, all
Yeah.
of us are going 100 miles an hour all day long and our lives are so busy. And, the inclination is for me to say, you know what, I got to check my email one more time before I go to bed. Then, of course,
Right.
someone sends me an annoying email and then I'm upset and my mind is racing about something. And so probably the biggest thing I've done is I just say, at around, go to around bed around 10 o'clock. At 9 o'clock, I just say to myself, you know what, I'm done. I'm putting all this stuff away. If something urgent, someone's going to find me. If not, I'll figure it out when I deal with it tomorrow. And just trying to give my body a little time to go from that sympathetic fight or flight gas pedal mode
Yeah.
to the brake mode and just allow myself to slow down. It's really not very elegant advice, but I do think it's helped.
Oh, huge. And the training of that process can be a lifetime training of how to be a person that can even know themselves to put that break in place when they need
Well,
to.
and it's a process, Molly. Some days are
Yes.
better than others. Some days there's stuff going on you can't control. You do the
Ah,
best you can.
100%. Well, I like that. And then also just the acceptance of the human condition that you're not bad or wrong if you're not able to always, with perfection, control that response. So that's fantastic as well.
Yep.
And I'm sure people listening now have had the experience that there is just a ton of information that you have on, I know we just spoke to sleep apnea largely, but certainly that extends out to many areas of sleep that you are well versed in. So how can people follow more about what you're doing or work with you? Let us know all the ways they can do that.
That's great. I really appreciate that. I'll be honest with you. I'm just getting started with trying to get the message out. And I think my aha moment for me, was that in the last couple months, I realized that I've kind of come up with this way that I approach things. And like I said, it doesn't make me better. It just maybe a little bit broader perspective on things.
Sure.
And I'm really finding that, I ask at the end of every visit, I ask my patients, okay, does the plan make sense? Do you understand where we're doing what we're doing? And they, for the most, well, always, or I keep going until they say,
Yeah.
but they'll say, you know what, this makes sense. I understand what we're doing. And I just realized with everybody suffering so much, these tens of millions of people out there, and not just them, their spouses suffering with snoring and sleep apnea and all the consequences of that. I'm helping people, but I'm helping people one patient at a time. So my
Mm,
motivation, and I appreciate you having me on, is
yeah.
in my own way, I just want to start trying to reach out to more people. So, I've got a
Great.
website, Sleep Checkup MD, and I'm starting to get going on Instagram. Full disclaimer, as you all go and check out, there's not much there yet. There will be.
Work in
I'm early in the
progress. Yes.
process, but I'm committed to what I want to do in terms of, getting the message out there. and really just helping in any way I can.
Oh, fantastic. Wow. Well, thank you so much. And I'm so glad that you are committed to that because this is such an important area. And I know you touched on just the deleterious effects that can happen when these things go unchecked. And it is just astronomical the difference that this can make for people when they do. One, take the steps to get this tested. Two, actually take the steps to understand the treatment options and find the right treatment for them. And it can be such a rewarding thing. It can, the colors can be brighter, it can just be such an amazing experience of life that they might not have really ever been privy to in their adult lives. So really important stuff. And I thank you for doing the work you're doing.
Well, thank you so much.
Oh, well, thank you. You've been listening to the Sleep is a Skill podcast, the #1 podcast for people who want to take their sleep skills to the next level. Every Monday, I send out something that I call Molly's Monday Obsessions, containing everything that I'm obsessing over in the world of sleep. Head on over to sleepisaskill.com to sign up.